I'm live. I continue reading Many Lifetimes. It's a collaboration between Joan Marshall Grant and Denys Kelsey. They are both therapists, hypnotherapists. Joan Marshall Grant is also a psychic, and her main subjects have been, in her various books, the subject of reincarnation and ethics. Here they have different cases which they are explaining of how they treated these in their respective way of treating. Joan is a psychic, as I said, and therefore she handles things slightly different. They work together. I was here in chapter 4 where Denys has described this young man who he cured of his anxiety. Of the general validity of Joan's ability to shift level and identify with an earlier personality of someone with whom she has a personal link, I have nothing. Recovery followed identification with a wife is exceedingly interesting. If this story had offered him merely a convenient fantasy behind which he could shelter, I think it is virtually certain that he would have relapsed within days or weeks. And unless Joan, by some process which does not fall within the ordinary framework of understanding, had been able to relive the experience on his behalf, I think it is most improbable that he would have recovered without undergoing an intense upreaction himself. One evening, the conversation had turned upon the probable causes of alcoholism. No one had contributed anything original, so after dinner I asked Joan to shift level and see if she could find any relevant information. She lay down on the sofa, closed her eyes, and in a couple of minutes snapped her fingers to indicate she was ready for the first question. What are the causes of alcoholism? I asked her. There are many causes, but one of them is when alcohol has been used as a primitive anesthetic to dull the pain of amputation. I'm seeing men who have been wounded in a minor battle. The period is the Napoleonic Wars. They are in a large barn which is being used as an operating theatre. There are holes made by cannon fire in the walls. Some of the wounded are lying on straw, the others on the earth floor. A surgeon, holding a blood-stained sore, is leaning against a trestle table waiting for the next patient to be put on it. The surgeon is exhausted. The men, waiting their turn, are trying to drink themselves into oblivion, or at least to get drunk enough to numb the pain. But some of them vomit a crude eau de vin before it has had time to take effect. The Frenchmen and the enemy, I don't know their nationality, except that they are not English, have tremendous compassion for each other. It seems quite irrelevant that they have so recently fought on opposite sides. The stench of gangrene is appalling. I shall have a break. I'll have to break off for a minute, or I shall throw up. When she had again shifted level after a brief rest, I repeated my question. Now I am seeing one man much more clearly than any of the others. He is in great pain and in despair because his shattered leg will have to be cut off. He has had some eau de vin, but not enough to help him. He is terrified of screaming when he is carried to the table and of dying of pain. He's watching the leather jug, which is being taken from man to man on the other side of the barn. He is praying that it won't be empty before he gets another chance at it. He has an anguished longing for more and more alcohol. It is the only hope of dulling his agony. He died of loss of blood while he was still longing for alcohol. Someone who has died when longing for alcohol to stop unbearable pain may find that pain reawakens his longing for alcohol. But he wants more and more of it, because in the original situation he did not get enough of it to do any good. This is the start of the craving. How can the condition be cured? In the case of the wounded man, take him back to the original situation, but be sure that he has not taken any alcohol when you do so. It is important that he does not confuse the present with the past. He will be freed only by regressing, unless someone like me can relive it for him, and so release the trapped energy. This used to be done by priests, usually by two of them working together. This was so that the two priests could check with each other to be sure that neither had missed any factor, and also because they could share the burden of identification. It is the release of the repressed energy which causes the abreaction. Either the patient feels it, or it's felt by the person who is acting as a priest. Can you tell me anything about addiction to morphia? Opium I have known in many lives. It was used in very wise civilizations, but it is important to give enough of it. A quarter of grain of morphia can arouse a need which it does not satisfy. It is the unsatisfied need which leads to the desire for more, and so leads to a craving should the person die in acute pain. Was opium used for other purposes except the relief of pain? Only by fools. There had already been several occasions when Joan, either through a dream or during a level shift, had produced some specific piece of information, which, although it had no relevance to anyone we had yet met, soon proved to have preceded the arrival of a patient to whose therapy it was entirely opposite. I am inclined to think that it was more than a coincidence that soon after the episode of the Neapolitanic soldier who had died in agonizing sobriety turned the amputation of his leg, something very akin to the mechanism of alcoholism she had described was observed in practice. A young man who was visiting friends nearby came to dine with us one evening. He confided to me that he feared he was becoming an alcoholic and asked me if I might be able to help him. He had to leave in 48 hours, which, I pointed out, did not leave us long for therapy. However, he agreed to the suggestion that we might have 2 preliminary sessions, and then, if he felt they were promising, he could return as soon as possible. He was highly intelligent and rather cynical, and had frankly admitted that he could not accept our theories about reincarnation. I thought he would be difficult to hypnotize, but he reached a deep level very rapidly, and immediately went into a curious spasm. I called for Joan, and by the time she arrived, in a couple of minutes, the spasms had turned into a violent writhing, which affected only his head and trunk. It seemed as though he was struggling to escape